Curious to know about monkeypox virus diseases? Continue watching this video to get the right answers from a doctor. Hello, I'm Dr. Harshitha, a general physician. I'm here today at Assurance by NanoHealth, one-stop destination for all the health services, to share with you what exactly is this monkeypox virus disease. So even before I begin the video, fortunately, let me tell you, at the time of filming this video, not even one case has been recorded in India yet. Still, it is important for you to know about this disease because only when you know, you'll be able to prevent it, recognize it, and when you recognize it, you can take the right steps required. So let's begin. Firstly, this is a viral disease just like cold, flu, COVID-19, which spreads through a virus. This virus is majoritarily present in monkey, hence the name monkeypox viral disease. So how does this virus gets transmitted to humans? So it usually gets transmitted to different rodents like rats, squirrels. These rodents transmit this viral diseases, and it can also transmit from one human to another human due to contact with any of the body fluids, any of the clothing, or rashes, which I will come to shortly. So it usually gets transmitted to us humans through other animals or through other humans itself. So once it gets transmitted, it takes about 5 to 21 days for your body to show any symptoms. In this period, which is known as incubation period, is when the virus is replicating, multiplying. Thankfully, during this time, the virus does not spread to other human beings. So it is a safer incubation period. Unlike in COVID, the virus used to even spread during multiplication. In monkeypox, it does not spread during incubation period. It only spreads once the symptoms appear. So symptoms can appear anytime between 5 to 21 days. The main majority symptom, which is the differentiator of monkeypox virus disease from other diseases, is rash. So a significant rash develops at either your tongue or mouth and then starts spreading across the face, and then from face it goes on to spread to the hands, the palms, the feet, and the sole of your feet. It can spread within 24 hours. So it first appears at the tongue or the mouth region, and from there in 24 hours it can spread to the limbs as well. This is the majority or the key differentiating feature or the symptom, you can say, from other diseases out there. Along with rash, there can be symptoms like fever, cough, cold, body aches, headaches. So these are other common symptoms which are present along with fever. Sometimes all of it can be present, or sometimes two or more are present. Usually starts with fever and rash. This is the ideal combination, fever and rash. So once you develop any such symptom, you need to of course visit your doctor. A teleconsultation is preferred more than an in-person consultation, because once you've started to show symptoms, you can spread this disease to other people. So preferably stay in isolation so your family members and your peers are also protected, and see a doctor via teleconsultation. So your doctor will examine you and then will begin with symptomatic treatment for reducing your fever, treatment to apply on your rash. There will be creams prescribed for your rashes so the rashes and all reduce. And to confirm the diagnosis of monkeypox virus, your doctor will also order an RT-PCR test, PCR test to confirm the diagnosis of monkeypox viral disease. The diagnosis usually gets confirmed and it gets notified to the government that okay, this is a case of monkeypox virus disease. So once you begin on treatment, what actually happens? Usually it takes about 2 to 4 weeks for all the symptoms to disappear. It usually takes the rash itself to disappear completely, because the rashes have its own journey and rashes will take some time for it to completely disappear. But other symptoms like fever, cough, headaches, they usually get relieved in 2 to 3 days itself of beginning the treatment. And that is one of the advantage of this disease, that it's a self-limiting disease. In usually 2 to 4 weeks, the disease subsides by itself. There are very rare occasion that it develops into complications, like it can lead to severe eye infection, which is known as conjunctivitis, can lead to blindness as well, can affect your cornea. It can lead to chest infection, which is pneumonia. It can at times lead to complete blood infection as well. But those are very rare incidents, and those are the reasons why we are making this video, because when you know of the complications, you know what exactly needs to be done and at what time needs to be done. So anytime you have those symptoms, you reach out to your doctor and get it checked. So this was all of the course about the treatment and the journey of the disease. But what can you do to prevent it? To prevent it, first thing, maintain your hygiene. It's very important to have a good personal hygiene habit. Make sure you're washing your clothes are not coming in contact with any sick person, you're not using any sick person's clothing. Make sure your environment is rodent free. There is no movement of squirrels, rats in your house, at your workplace. Your environment is rodent free. Third, if you're going to places where this disease is endemic, so this disease is actually endemic in regions of Africa. It started slowly spreading in America as well as Europe as well. So if you have any travel history of any such places, then please be extra cautious about how your body is behaving. Are you developing any kind of symptoms? Then notify to your doctor immediately so necessary steps can be taken. So yes, these are the ways to prevent it. So go ahead and be aware of what this disease is. This is to provide you knowledge so you know exactly when to take what step needs to be taken. It's not to give you more fear and anxiety. It's to give you information so you can make the right choice. Bye bye. Stay healthy.